Hi, it's Dr. Silva. Thanks for joining me. Today I'm going to talk to you about histrionic personality disorder. This is according to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, which came out in 2022. So the core feature of histrionic personality disorder is, quote unquote, a pervasive pattern of excessive emotionality and attention seeking. And like all personality disorders, this has to begin by early adulthood at the latest. Usually we see signs of it in adolescence, and it must be present in a variety of contexts. So it has to be across the board. It's not just in this situation or that situation or in the context of specific relationships. This is a pervasive pattern that's seen in all contexts. One of the things that's also interesting about personality disorders that's different from the other disorders in the DSM is that you have this criterion that always says, at the end of the list of all the symptoms, you have this criterion that says it must cause clinically significant impairment in social, academic, or occupational functioning. So it's got to cause impairment in one of these spheres or significant subjective distress in order to qualify for a diagnosis of a disorder. You can have all these symptoms, but if it's not causing distress or if it's not causing impairment, then it's not a disorder. And what's interesting is that you don't see that explicit criterion in the personality disorders. And my take on it is because if you meet the criterion A, if you meet 5 out of 8 of the following list, then by definition, it's causing at least social, at least interpersonal dysfunction. You still have to make sure before you make a diagnosis that it is indeed causing that impairment. So according to the DSM, for histrionic personality disorder, there are 8 possible symptoms under criterion A, and you have to meet 5 of them for an official diagnosis. And I always point out that in real clinical practice, if I see somebody who's got 4 out of 8, I'm not going to not diagnose histrionic personality disorder if they are obviously a histrionic personality and there is this distress or this impairment that meets the criteria for a diagnosis. The 5 out of 8 is arbitrary, and it is established as a cutoff for research purposes. So if I'm doing research on histrionic personality disorder and I'm trying to decide whether or not a person meets the criteria for the study, then I have to use this guide in order to reduce the chances that the sample that I'm studying is not an homogeneous sample. So that's for research. That's as a research tool. So, criterion A. Number 1, the individual is uncomfortable in situations in which he or she is not the center of attention. They feel underappreciated or unappreciated when they're not the center of attention. And the DSM describes these people as, quote, lively and dramatic, close quotes. It notes that these individuals may initially charm new acquaintances with their enthusiasm, their flirtatiousness, and their apparent openness. These qualities wear thin, however, when they continually demand to be the center of attention. They commandeer the role of, quote unquote, life of the party. And if they're not the center of attention, they might act out, they might do something dramatic to bring the focus back on themselves. They might cause a scene, they might start telling stories, making up stories. In clinical practice, this need is often apparent in the form of being very flattering to the doctor, bringing gifts, and also providing dramatic descriptions of symptoms, both physical and psychological, that are replaced by new symptoms at each visit. There's actually an association with another disorder called somatic symptom disorder. That disorder is an anxiety disorder that's characterized by a preoccupation with one's own symptoms. And these individuals with somatic symptom disorder, they spend a disproportionate amount of time and energy worrying about their symptoms, thinking about them, and having persistent thoughts about the seriousness of their symptoms, anxiety about their overall health. And so there's an association here, probably because of this tendency with doctors to be very dramatic about their symptoms. It's not clear, though, with histrionic personality disorder, whether they're actually truly preoccupied or whether they're putting on a show when they come into the doctor's office. So I think I would suspect that that association would be a superficial one, because one is a personality disorder and the other one is an anxiety spectrum disorder. Individuals with histrionic personality disorder are not necessarily anxious individuals. Number 2, interaction with others is often characterized by inappropriate, sexually seductive, or provocative behavior. They're flirts. They're huge flirts. The prototype is the Southern Belle. That was always the example that was given to me as a medical student and as a resident. And so you think Scarlett O'Hara flirting with the Tarleton twins.
I never can make up my mind which of you two's the handsomer. I was awake all last night trying to figure it out.
But this seductive behavior, it's beyond what is appropriate for the social context. And that manifests most strikingly in the fact that they do this not only toward persons in whom they actually have romantic interest. This is everybody.
I think Charles Hamilton may get it.
Oh, thank you, Miss O'Hara. Thank you.
Including clinicians. So it can be very inappropriate, obviously. The individuals are trying to seduce your attention. They're not necessarily trying to actually have sex with you, but they can be very alluring and they can have all this come hither attitude, because what they want, what they really are desperate for, is your attention. Number 3, displays rapidly shifting and shallow expression of emotions. These individuals are shallow. It doesn't take much to get them to invest, even in their own minds, somewhat sincerely in any given emotion at any given time. They also fake emotions. There's a lot of fake crying that can go on. Number 4, consistently uses physical appearance to draw attention to self. And this is again maybe related to the flirting and the wanting to look good. But the wanting to look good, this manifests as expending an excessive amount of time, energy, and money on clothes and grooming, and all to look their very best. They may fish for compliments regarding their appearance, and they may also be very easily and excessively upset by critical comments about how they look, or in seeing a photograph that they regard as unflattering. None of us likes to see a bad pic, but individuals with histrionic personality disorder can really go through the roof. Oh, I look awful in that. How dare you take that, erase that, delete that right away. And they may be overly preoccupied with that. Number 5, has a style of speech that is excessively impressionistic and lacking in detail. These individuals express strong opinions with dramatic flair, but when pressed, their underlying rationale is usually vague or diffuse, without supporting facts or details. For example, they might say, oh, such and such is a wonderful human being. And when you ask why, they draw a blank and they can't give examples to support their conclusion. They'll say anything to hear the sound of it, and if it, again, leads all eyes on them. If it's part of their soliloquy, and if it sounds good, then they will say it. Even if they don't really mean it, they can't mean it because they don't really know it, because when you press them on it, they can't back it up with facts. So these opinions are just being spouted off the top of their head to be dramatic and to hog the spotlight. Number 6, shows self-dramatization, theatricality, and exaggerated expression of emotion. This can be embarrassing to friends or acquaintances when it takes the form of an excessive public display of emotion. And examples would be embracing casual acquaintances with excessive ardor, or sobbing uncontrollably. Funerals. You might see somebody who barely knew the deceased, and they come in and they got their handkerchief out and they're crying before they've even crossed the threshold, because it's about them. They're not really that upset, but they give themselves over to this histrionic tearfulness that's very obvious to other people. So obvious that other people often accuse them of being fake. Or throwing temper tantrums. That's another example. They might get really mad and they're fuming mad, and maybe they're not really all that mad, but they are expressing their displeasure in very over the top, very theatrical and dramatic ways. Their emotions seem to be turned on and off too quickly to be deeply felt, which is the case. That's not just the appearance, but that's the case, in my opinion. And again, that leads others to accuse them of faking emotions, which again, they often do. Number 7 is suggestible, that is, easily influenced by others or by circumstances. These individuals often form opinions and their feelings are swayed by other people and by current fads and trends. They may actually be overly trusting, especially of strong authority figures whom they see as magically solving their problems. And this certainly includes clinicians. So when you have a patient who is showering you with compliments, who tells you you are the best doctor they've ever had, who brings you gifts, that's a sign, that's a red flag. Number 8, considers relationships to be more intimate than they actually are. Everybody is their dear, dear friend, and this can also take the form of referring to their physicians on a first-name basis when they've only met them once or twice and always in a professional context, because they assume this closeness and this familiarity that's just not there. I have to say an aside here about patients who call me by my first name. It's not always indicative of a personality disorder. There are exceptions. Patients I've known for a long time, especially those who ask my permission, who ask if it's okay to call me by my first name, or those with whom I'm conducting individual psychotherapy. If I'm seeing somebody on a regular basis for an hour and we are conducting therapy, sometimes they will ask if they can call me by my first name, and that's not inappropriate at all, especially if they ask me. But it's the patients who don't ask my permission and who start calling me by my first name. That is usually indicative of narcissistic personality disorder because they're trying to level the playing field. They feel threatened by the fact that they see you as an authority figure on a pedestal. They're trying to take you down a notch or two so that they can equal the playing field. And also it's a part of the narcissist's need for self-aggrandizement. And so they start calling you by your first name and they don't ask permission. And they never do, narcissists. And then they wear your name out. Not only are they calling me by my first name, which my first name is Sergio, so unless you speak Spanish, you can't even pronounce it. They're wearing it out. So it's every turn, every sentence. It's just really unnecessary to say my name. Even if they were saying Dr. Silva, it would be unnecessary for them to be saying it as much as they're saying it. The histrionic personality, they do it for a different reason. They do it so that they can be inappropriately chummy. Associated features with this personality disorder, it's interesting that the impairment in general tends to be less than many of the other personality disorders. And it is almost exclusively interpersonal. Again, you don't have that explicit criterion that says you have to have clinically significant impairment in social functioning, but you can't have all of these inappropriate behaviors and meet 5 out of 8 criteria and not have some problems in your interpersonal functioning. You can't demand to be the center of attention and fake emotions and make up stories and make up opinions and have this kind of behavior and have healthy social relationships. You just can't. Clinically significant, by the way, means that it requires treatment, that either you or your loved ones present for treatment. So you might not think that you need to go see a doctor about it, but your family members may demand that you get some help. Also, these individuals, they have an interpersonal style that's characterized by social dominance. So they tend to be controlling in the context of their social relationships. And this can span a spectrum of behaviors. The DSM, they describe a quote-unquote warmer dominance type, which can be very intrusive and dramatic, as opposed to a quote-unquote colder dominance type that is more controlling and can be arrogant and even aggressive. Romantic relationships for these individuals appear to be particularly impaired, not surprisingly, and there is evidence to suggest that individuals with histrionic personality disorder are less likely to get married, and those that do get married are likely to get divorced. And so, as with the borderline personality disorder, if you see a lot of divorces, and I'm talking like more than 3, 4, or 5 divorces, then that's a red flag. You definitely have to look at that and say, why is that? Sometimes it's because they got married when they were 14 or 15 because maybe there was a pregnancy or something. Give somebody at least 3 divorces. It's sort of 3 strikes and they're out kind of thing, because you can get married and then that person could maybe be unfaithful or be abusive or do other things, or they may leave, so you might be abandoned, and it's not your fault that you got divorced. You got divorced because the other person didn't want to be married to you anymore. But once we get to about 4 marriages, and certainly anything more than that, and it means something. Something is going on psychologically. You may not have a personality disorder, but something's up, and it's usually character pathology. It's usually a personality disorder. But these individuals may actually be impaired. They may actually have difficulty achieving emotional intimacy in romantic or sexual relationships because they lack authenticity. They're inauthentic people. Also, these individuals often have impaired relationships with their friends. The DSM says, quote unquote, same-sex friends, but that assumes that all your friends have the same sexual orientation as you. It doesn't work. It should be revised. The text revision should be revised again, and they should not be saying same-sex friends, because you don't know. You don't know what your sexual orientation is. You don't know what your friend's sexual orientation is. Rather, if you and your friend share the same sexual attraction, so if you're both attracted to the same sex, then there could be impairment, specific impairment, because the friends may feel threatened because of the individual's sexually provocative behavior, or sexually provocative interpersonal style.
What's your sister so mad about, Scarlett? You sparking her beau? As if I couldn't get a better beau than that old maiden Bridget.
That may be threatening.
Prince, Stuart Carson.
Women, for example, let's say heterosexual women, they may not feel comfortable leaving their husbands alone in the company of this quote-unquote Southern belle. I don't want to denigrate women from the South. That's an old example that was given. But think Scarlett O'Hara, that type. You wouldn't leave Scarlett alone, and the women in that movie. And she actually did steal her sister's boyfriend and married him to pay the taxes on Tara. So anyway, but more than that, they alienate their friends with their constant demand to be the center of attention. And individuals with histrionic personality disorder become depressed and upset, genuinely depressed and upset, when they're not the center of attention. They also have a greater tendency to become bored. That is also a feature of other cluster B personality disorders. So they might turn to novelty or stimulation. They may seek excitement in order to allay those feelings, and can be intolerant of or actually frustrated by situations that involve delayed gratification. Their actions are often directed at obtaining immediate satisfaction. So these individuals will often initiate new jobs or projects with great enthusiasm, but then their interest lags quickly. And that can spill over into their social relationships. Longer-term relationships might be neglected or even abandoned to make way for the excitement of new relationships. So you can see how that would impair romantic or sexual relationships that are intended to be long-term relationships. Even if these individuals have children, they compete to be the center of attention. So you might see, as with narcissistic personality, you can see jealousy between mother and daughter. And I use a lot of female examples. The disorder is more common in females than in males. I don't know what the stats are in gay males, so it may be the feminine archetype. It may be those individuals that have more anima than animus, but there's an unequivocal association there. It's not misogynistic to say. And lastly, I just want to say that context is always important. It's important for all of these disorders, all psychiatric disorders. Emotions and behaviors are not enough unless they're causing so much subjective distress, unless the individual is so unhappy, then you don't look at the context. But when you really are trying to assess social, academic, and occupational functioning, you have to look at the context. And despite the fact that there's no explicit criterion for the personality disorders, it is important always to evaluate whether the behaviors are actually causing significant impairment or distress in those spheres. And for example, in the context of the individual's culture. And more subtly, we need to distinguish this personality disorder from the reactive and contextual expression of these traits, arising in response to socialization pressures in competitive peer groups. And this includes the quote, need to be liked, close quotes, that you might see, for example, in a gaggle of teenage girls at camp, where they may all be acting kind of along those lines, trying to steal the center of attention, maybe being flirtatious with the boys, being dramatic in the way they express themselves, expressing shallow opinions that they haven't really thought through. But that doesn't mean that they have a histrionic personality disorder, because the behaviors, the traits are not persistent and enduring. Once they're back home and once they're outside of that gang of girls that they don't know that well, and they're back with their normal schoolmates with whom they have stable friendships, then they don't need to act in that way. And so that competitive socialization, that element is taken out. So that's a very specific example that's given in the DSM, where you might see histrionic behavior in individuals who do not otherwise suffer from histrionic personality disorder. And ultimately, many individuals, both men and women, may display histrionic personality traits from time to time, but only when those traits are inflexible, maladaptive, and persisting, and only when they cause significant functional impairment or subjective distress do they constitute histrionic personality disorder. There are associations with other personality disorders, especially cluster B, the dramatic cluster, as well as with substance abuse, and as previously stated, somatic symptom disorder, as well as functional neurologic symptom disorder, what we used to call conversion disorder, where a person has a neurologic deficit, but there's no evidence of damage to the nervous system. There actually is no damage, so it's completely psychological, as well as major depressive disorder. Thanks for watching.